for joining us for today's important Virtual Advocacy Day webinar. We will soon be joined by Dan Frey, the AIDS Foundation of Chicago's Director of Government Relations, but first have a few housekeeping items to go over. All participants are in listen-only mode, but we encourage you to use the question feature on the right side of your screen to ask questions throughout the webinar. We will answer questions at the end of Dan's presentation. If you are unable to hear the audio, you can dial in using the telephone number and access code provided on the Audio Control tab on your computer. We also encourage you to download the slides after today's webinar. They can be found in the Advocacy section of AIDSchicago.org and will be tweeted out on AFC's Twitter account after the webinar concludes. We also ask that you please live tweet during the webinar using the hashtag JustAdvocate and hashtag PositiveBudgetIL. I'll now hand it over to Dan Frey to talk us through the current budget crisis in Illinois and ways we can get involved and help encourage advocates to pass a positive budget.
Thank you, Molly. First, I just want to say good morning, everyone. Thanks for joining us. Representative Feigenholz was supposed to be with us today, but she got called into committee and thus was unable to come by, so she sends her apologies. I just want to start off with the Illinois budget situation and the problem, which is why we are in this mess in the first place. It's because Illinois does not have enough revenue to meet the services that we expect and need in this state. We passed an income tax increase in 2011 that has since expired. The plan was last year was to get Governor Quinn reelected and go from there. When that did not happen, Governor Rauner and the General Assembly let that increase expire, and thus we are facing a $6 billion budget hole. The demand for services exceeds the state's revenue. We just have the same demand we did before that increase expired, but we do not have any new revenue, and the governor has pledged not to raise any taxes. He has shown behind the scenes some willingness to talk about some revenue, maybe, but in public has very much been anti-revenue. Representative Durkin, who's the GOP House leader, this week even pledged no new revenues. So there's a political fight here on our hands to preserve the services that we hold dear. Because of that, the governor each year proposes a budget to the General Assembly. He has to do that by law based on the current revenues the state has. And because of that, he had to propose drastic cuts to the FY16 budget, which starts in July. Next slide, please. Okay, specifically, since we are the AIDS Foundation, the HIV/AIDS cuts. The HIV services lump sum was reduced by 25%. That's a reduction of $6 million. And the African American HIV/AIDS Response Fund was reduced by 66%, which is $1 million. First, I'll talk a little bit about the HIV/AIDS Response Fund. Actually, next slide. We'll go in detail of that in just a minute, actually. Other cuts include Medicaid funding, which was cut by $1.3 billion and rolled back to SMART Act levels. What that means is in 2012, the House Representatives and Senate and the governor signed the SMART Act, which was just basically a reform of the Medicaid program in Illinois, and it cut about $2 billion from the Medicaid program. Because of that, so things like we're rolling back in the governor's budget to those reforms, which some have been restored last year in another bill. So some of the things that come with that cut in rolling back is a $120 million cut. We roll back rates to 200, which saves $200 million. It eliminates the hemophilia assistance program. It eliminates adult dental coverage. All accountable care entities and coordinated care entities, ACEs and CCEs, move immediately to full capitation. Just for layman out there, capitation is a payment arranged for healthcare service providers, such as physicians or nurses. It pays them a set amount for each enrolled person assigned to them per a period of time, like per month, and that is whether or not they seek any services. In addition to those cuts, lots of programs are cut, such as the supportive housing. It's reduced by 100%. It's just eliminated. There are other things that are eliminated are Best Buddies, ARC of Illinois, the Autism Project, Homeless Youth Services, Teen Reach, Immigration Integrated Services, breast and cervical cancer screening is reduced by $9.8 million, and BASWA, which is Brothers and Sisters United Against HIV/AIDS, is also eliminated. The Department of Human Services total cut amounts to about $400 million. Next slide, please. ADAP, that is the AIDS Drug and Assistance Program. That is a 25% reduction, $6 million. So what happens with the ADAP program is it is a federal program that is designed to help people to secure their HIV drugs. But it does, the lump sum does a lot more than that. It also invests in prevention services and education services. This $6 million reduction would essentially roll back those services. There would just not be enough money to fund the prevention and educational services. So basically we'd be just funding the drug assistance that we provide, and thus we would be putting a lot of people in danger. If you don't invest in prevention services, you're going to have a lot more people who are getting infected. As we like to say, prevention is treatment. So next slide, please. Prep for Illinois was something that was included in the FY15 budget. It was $1 million of the $26 million appropriation. When Governor Rauner was sworn in, he put a freeze on all implementation of new programs within the FY15 budget. So the $1 million that was used had already been used to establish the program and the groundwork for launching Prep for Illinois. But because of that freeze, though the program is ready to go, it is not being implemented and put out to the public. Prep for Illinois is I should explain, it's a program that utilizes the PrEP program, which is a drug you can take daily to prevent HIV infection. It is over 90% effective in preventing HIV, and it is really a great deterrent for people in need of that. So by freezing this program, the governor is really putting at risk people who are at risk of getting infected. It was something we were very excited about at AFC, and we are continuing to push for him to simply unfreeze that program. Next slide, please. So the African American HIV/AIDS Response Fund, or ARF, was appropriated $1.5 million in FY15. However, that appropriation was never funded. What that means is, so the General Assembly passes a budget each year, which gives appropriation authority to various departments. But if you, this fund has to have money in it, so you have to actually put the money in the fund to match an appropriation, which never happened. Due to that, the money was never spent. There were grants approved, but never sent out to the community. And we are still fighting for that to be funded and sent out. In addition to that, the FY16 budget was appropriated $500,000, which is a 66% cut. However, there isn't even $500,000 currently in the fund. It sits at present at about $224,000. So we are calling on the Department of Public Health, the Governor, and the General Assembly to not only fund the FY15 appropriation, but fund another full $1.5 million for FY16 and appropriate it as such. Next slide, please. So revenue is what we need to fix this problem. We have a revenue problem in Illinois, not a spending problem. We have services that require money to be spent on them. We don't want Illinois to become Alabama. We want to have these services to provide to our citizens. So to do that, we need to increase our revenue that funds these programs. There's no easy solution or a way to cut our way out of this. We just need some sort of revenue enhancement. It needs the political will, however, to be enacted. It is not ever popular to say, I want to increase your taxes. You can generate, however, political will by talking to your legislators and telling them everything that you hold dear that a tax increase would fund. There is an increasing amount of political will, I think, being generated in the community because people rely on these services and they need them to get by. So when the 2011 tax increase expired, the budget did not reflect that. So not only is the FY16 budget in danger, the FY15 budget has yet to be fully funded. They're currently working on a deal between the governor and the General Assembly to reach a solution, but programs such as the African American Response Fund and childcare are not funded for FY15. So what we need is for people to give their legislators the political courage to say, we stand for more revenue and because these services are important to us and to our community. Next slide, please. So how can you do that? AFC is holding advocacy days just like this, but actually in Springfield on April 15th and March 13th. You can register for those at agechicago.org/advocacy-days or contact Molly at mcandrew@agechicago.org. We're going to have training in the morning, breakfast and lunch. We'll bus you down from the city, and then we'll talk to you about how to talk to legislators and who you should talk to and what to say, and then we will go out and actually go and talk to them and try to make your voices heard as best we can and just try to give them the courage to push for more revenue in the state and to fund not only HIV treatments and our African American AIDS Response Fund, but all the services that really make this state a great place to live that we do not want to lose. And that is all I've got. So I would welcome any questions that you might have.
Great, thanks, Dan. So we'll move into questions at this point, and I will moderate. Excuse me, and Dan will jump in with his answers as we move forward. If we are unable to answer your questions this morning, we will do our best to follow up with you offline and get you the information that you've requested. So, Dan, can you? We have a question here. Can you talk a little bit more about the African American HIV/AIDS Response Fund and what happened last year?
Sure. Yeah. So it was appropriated $1.5 million, but the fund was the money in the fund was swept to other programs to fill other holes, and it was never replenished. And because of that, none of the grants that were applied for actually were sent out into the community. So those service providers at the community level were never actually funded. We are working to get that funded, that $1.5 million, but at present they have not replenished the fund.
Great, thank you. We have another question here about the SMART Act levels of Medicaid. Can you just again go through again the what that means for consumers in terms of what services will be eliminated and what services will be cut for those who are on Medicaid?
Sure. So if you're on Medicaid and this budget were enacted and these reforms enacted, dental coverage for adults would no longer be covered, which is something that the SMART Act implemented in 2012 but was restored last year. So if you have hemophilia, you would not be able to get treatment under Medicaid, which is an incredibly expensive disease to treat and incredibly risky disease. So that is actually a very hard cut. Those are the main big things that are just eliminated. Just overall, people would see less. They would see less coverage when they go to the doctor under Medicaid program. They would have They would have less services provided for them.
Great, thanks, Dan. Another question here about ADAP. Can you talk a little bit about the department's plan to move individuals who are receiving services and premium payment assistance through the AIDS Drug Assistance Program, and the department's plan to move some of those people over to the marketplace?
Sure, yeah. So that is the department, their reasoning behind their $6 million cut is that they will see savings by moving consumers onto the marketplace. While they have been aggressive at doing that and very successful, and that does save money, it still would be a hardship for people in the ADAP program. Because even if you're on Medicaid and in the exchange, you need ADAP, or some people do need ADAP to get their drugs. Because of that, we believe they should invest fully at the $26 million level, so that we can better help these people and to invest in prevention services such as PrEP and other such programs, so we can keep people from contracting HIV and thus save money in the long run for the state and for individuals, and just increase their total health.
Great, thanks, Dan. A question here: can you offer suggestions or maybe thoughts that have maybe been kicked around as to what, how we can raise revenue, avoiding the route of new taxes, maybe in terms of amending tax codes and the such? Do you have any thoughts on what that could look like?
There are all sorts of ways you could raise revenue. In income taxes, the cleanest and probably least popular, and other types of taxes could be raised. There is tax reform. We could generate the will behind a fair tax, which that is. So Illinois has a constitutional amendment, or not amendment, a constitutional provision that states that everyone has to pay the same rate of taxes. For instance, your federal tax is progressive, which means if you make more money, you pay a higher rate of taxes. And if you make less money, you pay less. But in Illinois, that is not allowed. So there was a push in the past few years to get a constitutional amendment on the ballot to institute a fair tax. It has not been successful thus far. But that by going to a progressive tax system, we could generate revenue by putting higher taxes on the wealthiest and lower taxes on the lowest income in our state. There is tax reform, and tax loopholes could always be closed, but that's but you never know exactly how much revenue that will generate until you get in there and do it. So generally speaking, you could tax services, you could tax property. There are other things you could do, but those are the most revenue enhancing.
Great, thanks, Dan. There's a question here talking about Medicaid and potential cuts to Medicaid and how that sort of works with their interfaces with the federal money that we receive from Medicaid. And so I think this is getting to the point of Medicaid expansion and the feds paying for that for the first couple of years. Is there an interaction, or would we receive a reduction in federal money for that Medicaid if we were to start cutting programs, services, and maybe increasing even co-pays for office visits? How do those two kind of work together, if they do at all?
So it works a little differently for the Medicaid expansion population. Those are covered 100% for the next few years. Then it will start to gradually decline. But that population is covered unless we pass a specific law rolling back the Medicaid expansion from a couple years ago. But in terms of the general population under Medicaid who was covered before 2013, the 2013 bill, yes, if the less money we put into Medicaid, the less we get out of the federal government. They match us 50-50 on Medicaid spending. So any cut we make does put at risk money we get in.
Great, thank you. The next question is about pension. We've been hearing a lot about the pension bill or reforms here in Illinois. Can you talk a bit about what happens to pensions if the pension bill is ruled unconstitutional, and maybe give a little bit of background about this bill and sort of a little context about what's been going on?
Sure, yeah, my pleasure. The pension system in Illinois is underfunded. So what happened is the General Assembly and the governor in years past, like in the 90s, stopped making their pension payments because they had other holes. They wanted to do other things with that money, which created a hole in the system. And so also, so I think it was, I believe it was under Governor Edgar, created what is called the ramp, which created set amounts of funding and spending that the state had to pay each year in increasing amounts, so that they could make up that gap. It's an arbitrary number that they set in that bill that they could easily change, but because they aren't and haven't, we're in a real mess because every year we have to spend more on pensions. Why that's a problem is we have a constitutional provision that states that the state cannot we cannot negatively affect a person's pension, which means we have to find creative solutions to the pension problem. The bill that passed last year, many believe will be overturned soon, which just puts us back to square one. What would really help would be a constitutional amendment to work on that says we can do things with pensions. But if short of that, we have to find something that doesn't impair or diminish a person's pension benefit that also saves the state money. So if this bill is overturned, as the governor's proposed budget thinks it will, and offers a different solution that he equates to $2.2 billion in savings for the state over the fiscal year. But I should say, people do not believe that that is a realistic or feasible solution either, and I think it's referred to as a fake cut for this year's budget. That because of that, the General Assembly is given revenue estimates each year that they have to appropriate from, and because that cut would be considered fake, they would have to cut elsewhere in the budget to make up the difference. So without a revenue enhancement or realistic pension reform, the FY16 budget that the General Assembly puts out, if it adheres to the current revenue estimates, will actually be even worse than the governor's proposal.
All right, Dan, thank you. Quick question here. When does this fiscal year end and FY16 begin?
FY15 fiscal year, which is we are currently in, ends June 30th, and FY16 starts July 1st. So a fiscal year runs from July 1st to June 30th.
Great, thank you. Another question about the Affordable Care Act. So we've been hearing, or likely been hearing, a lot about talk about Republicans wanting to repeal the Affordable Care Act on the national level. Is that something that could ever happen here in Illinois?
So what could happen is, theoretically, there's a case before the Supreme Court right now that could remove the subsidies that the federal government pays to state governments to fund the Affordable Care Act. Theoretically, if the court ruled that the bill, the ACA, never intended for the federal government to supply states who hadn't set up their own exchange with those subsidies, which Illinois has currently not, we could lose that funding. That is, no one knows how the Supreme Court will rule on that, so at this point, no one is really working off the assumption that they will overturn that provision. But if that were to happen, there would be a lot of conversation about what we needed to do to move forward. But no, that conversation really hasn't, to my knowledge, hasn't really been started yet.
All right, Dan, can you talk a little bit about other bills and pieces of legislation that AFC is working on or looking at or in support of that are being passed or being moved through the legislation right now?
Of course. Currently, we are working on a cap the copay bill that is still in committee. So that bill would put a cap, two different levels of caps on prescriptions per month. It set for $250 for gold level or for bronze level, I believe, and $100 for silver. And that is a bill we're working on. Yesterday, we were working on a bill with Equality Illinois to ban conversion therapy, which passed out of a House committee yesterday. We are working on a bill for managed care organization transparency, which would make HFS continue to report data on managed care organizations. That bill is currently in committee. We expect that to be seeing a hearing soon. We are working on a bill that we passed a resolution last week in support of funding the African American HIV/AIDS Response Fund, that and creating a HIV Awareness Day. We are working on a bill that would ban in Medicaid an explanation of benefits being sent home for sensitive services. That bill is currently in committee and being fine-tuned, but we expect that and the MCO transparency bill to go forward soon. We're working on various hepatitis C bills. There's a large chunk of them in both the Senate and the House that we are working on for treatment and making treatment more readily available. I think those are the. There's one other bill that we are working on that was just assigned to committee yesterday in the Senate, which fully funded the Navigator program under the ACA, which at present are slated to run out of funding at the end of next month. So we are working hard to try to get that bill through so that we can keep those people employed and helping people navigate the managed care insurance system. And I believe those are the big ones we are currently working besides the budget, which is they don't have bills at this point, but it is a singular focus that we are on right now.
Thanks, Dan. Sounds like you're staying busy in Springfield. At this point, we are going to move on to talk a little bit more about what the rest of today's advocacy days look like, as well as the two Springfield advocacy days. At one point, please do continue asking questions if you have them, and we can address them before we close out the webinar. We have a question here asking how people can get involved and how the voices of individual people can push against these cuts, and how we can best be prepared to speak with legislators about these issues. So I'm going to hand it over to Joshua Oakes here at AFC to talk a little bit more about the rest of today and the Springfield lobby days.
Hi, everyone. Yeah, there are lots of ways to get involved, be it volunteering for an organization or attending events or donating to certain organizations that are helping fight against these budget cuts. But I want to start off a little bit talking about what we can do today. Today is our first virtual advocacy days, and we're very excited about this opportunity to bring this on a larger scale and into a digital world. So this webinar is only the first part of the process. So you'll see on your screen our second part, which starts at 10:30, is legislator outreach. And so the goal of this is to let Senate and House leadership, as well as the appropriations committees for both the Senate and House. And the reason we're targeting those is because they're really the first step in this, in kind of tweaking the budget and getting a fair budget pushed through. And also the governor himself. This is a great opportunity. We don't get very often to talk to the governor, but we can do that through his social media. But we're asking you to go onto their Facebook pages and use their Twitter handles today to post the sample messaging or messaging that you have or things that you want to say about stopping the budget cuts and asking them to find alternate revenue sources. and talking about about ADAP and cuts to Medicaid and all these really important issues. You'll see on the pages where you signed up for Virtual Advocacy Days and also under Advocacy Days 25 on the 2015 on the AFC website, a link to the Participants Guide. And the Participants Guide has everything you could possibly need to do the second part. It has all the hashtags. It has contact information for every member of both the Senate and House Appropriations Committees, and also their leadership. It also has the House and Senate, GOP and Democrats, individual social media pages. It also has Governor Rauner's information. It has sample Facebook posts, sample tweets on each topic that we talked about today and many others. It has sample emails that you can use, and you'll see specific emails for certain legislators. You'll also see links to contact pages through their website. So if they don't have a specific email, you can click on that, put in your information, and send it through their contact form on their website. It will still get to them. And there's also sample phone messaging. If you want to call them at their office, those phone numbers are on there. Their Springfield office phone numbers are on there. It's important to contact your legislators as well, even if one of the legislators in the two committees is not your legislators. You can contact your legislator and ask them to ask the appropriations committees to pass a fair budget and get involved in this fight. And you can, like I said, you can find that guide on the AFC website. And so we're asking to use hashtag JustAdvocate and hashtag PositiveBudgetIL throughout these tweets. So that's the second part. So we're hoping to really fill the legislators' posts. So post as many as you can on as many legislators, Twitter and Facebook. Let's just fill their feeds with this message so they see that we're here as one voice, one large group advocating for a positive budget. And then after that, so that's from 10:30 to 12:30. And then after that, starting at 1 o'clock, we'll have a Twitter chat about the state budget cuts specifically affecting HIV services. And we have about 14 to 15 organizations that are going to chat with us on that as well. Many of them are on the webinar now. And basically, it's very easy. We tweet out a question, and then you tweet us back an answer. So the answer should start with A, and then the number of the question, and then your tweeted answer, including the hashtags, hashtag JustAdvocate and hashtag PositiveBudgetIL. And then so we'll end that at 2 o'clock. But that doesn't have to stop just at that point. You can continue going throughout the day or in future, like messaging and using these two hashtags and making your voice heard on social media. I'm going to hand it over to Molly to talk a little bit about physical advocacy days, which we have coming up on April 15th and May 13th, and kind of what the day is going to look like on those.
Great, Joshua. So as he mentioned, the advocacy days are being held on April 15th and May 13th in Springfield. You need to register in order to participate, and this is very important. As you can see on the screen, you can do so at aidschicago.org/advocacy days. It's a very simple registration form. And we do ask various questions about not just yourself, but also sort of logistically what we can do to help you get to Springfield. And this helps us tailor that day to all of our participants and make sure that everyone is well prepared and ready to go down and advocate. So you will receive much more information once you register and once we get closer to these days. But generally the day looks like this. We will, if you decide to ride down to Springfield on a bus that AFC is sponsoring, we will meet here at our office in the Loop at 200 West Jackson. It's right off the Quincy Brown Line stop. We'll meet here and leave at 6:30. We'll head down to Springfield. We will have a sort of organizing and training session during which we will talk about the issue of the budget, sort of learn our talking points, get organized. Lunch will be provided, and then we will head over to the Capitol and begin talking with our legislators. Everyone will have information specific to them and where they live in terms of who their legislators are and how to contact them. We'll have many different forms of information you can provide, whether it be talking points you can use when you're speaking with them, pieces of information you can leave at their office, and phone numbers also that you can follow up with them once we get back once we leave Springfield. We will then have a reception that afternoon with one, if not two, or maybe three legislators. And then we will get back on the buses and leave Springfield around 4:30. For folks that aren't able to or decide not to ride down on one of our sponsored buses, we encourage people to drive down or drive to Springfield if they're able, and even plan a carpool within your community or organization if you're able, as a way to get as many people as we can down to Springfield. We've always had great successful events in the past, but we are really pushing for an incredible amount of people to come down and make it very clear to our legislators that this budget is absolutely abhorrent and that we need to pass a positive budget for Illinois. We have a couple more questions, Dan, from people about who they should be reaching out to and contacting. So this is a great question. If you are representing an organization, should you be reaching out to your individual legislator from your home and your home district, or should you be reaching out to the representative who represents the organization and where that organization is housed?
Great question. I would say first both. You could reach out to every legislator that you can. But most importantly, I would say, would be the legislators who sit on the Senate Appropriations 1 and the House Human Services Appropriations Committees, which are lists we can make available. Those are the people who make the initial decisions on the nitty-gritty of the budgets that affect AFC and our partner organizations in the human services world. So they generally come to the consensus on the levels of funding, the levels of cuts, and then they submit it to the House or the Senate floors for a full vote. But by getting in and talking to them on that level, you can really influence the budget process more intimately.
Great, thanks, Dan. A question here for Joshua. What is a good email subject line when sending emails to legislators?
Yeah, so there is the option to send in emails during this period of time and in the future. We here at AFC, to kind of get legislators used to a slogan that we're using, and we're using the hashtag #PositiveBudgetIL. We are using Pass a Positive Budget as the subject line to send. We also will have graphics available in the next week or so that you can take with you and include in your email or include in other social media postings that has the branding for Pass a Positive Budget. So I would say that's a really good subject line. And I'd say also go with, what you think gets the point across will get them to perk up and listen. But including that it's about the budget, I think, is really important.
Great, thanks, Joshua. Dan, a question here about Medicaid expansion. Can you explain or talk a little bit about what Medicaid expansion is?
Sure. Medicaid expansion was passed in 2013 in Illinois. It is made available by the ACA. Initially, the thought was in the ACA was to expand the Medicaid population to get people who were less well off, I guess I'd say. They did that, and then it was determined by the Supreme Court in the initial challenge that went to them that it had to be approved on a state-by-state level. So Illinois did that in 2013, and what it really did was provide coverage to a larger population in Illinois who were not currently eligible for Medicaid, but healthcare was still incredibly expensive for them to get on their own.
Great, thanks, Dan. With that, Oh, we have another question here. Does Illinois still have a Democratic majority in the Senate? And maybe you can talk about the party line in both Senate, House. If you can do that, Dan.
Sure. So yes, we do currently have a majority in both the House and the Senate. In the House, that majority is a supermajority. It is in the Senate as well, but in the House, it's more, I'd say, a more diverse Democratic caucus than you would think. So, for instance, there are Democrats from Southern Illinois who don't necessarily hold the same positions as a Democrat from the South Side of Chicago. Because of that, the supermajority is not normally something you can count on. We have the majority in both houses for sure, but a supermajority, so overriding governor's vetoes, is incredibly difficult, especially in the House. But yes, we do have a supermajority in both houses still.
Thanks, Dan. Question here, can you explain a little bit about the process in terms of passing a budget, sort of from inception, Governor Rauner introducing his proposed budget, and then the final product of a budget, of passing a budget? What does that process look like?
Sure. So the governor is he is required to propose a budget to the General Assembly and issue a budget address talking about it each year. He has to do so by law with the current state of Illinois' fiscal situation. So he can't, for instance, propose a budget that says, here's my budget if you passed a tax increase. So he has to do it based on what is currently the situation in the state. From there, the House and Senate each pass spending resolutions, which basically details what the estimated revenue for the state is for the year, and then divvies them up via appropriations committees. Then, working from those resolutions, each appropriation committee holds hearings for the public and for departments to come and weigh in. And then they meet. Sometimes both caucuses meet and work together, sometimes not. And they craft a budget going line by line through each department. So they'll look at the past few fiscal years. They'll look at the governor's proposed budget, and they'll look at how much money they have to spend, and they will determine for each line what amount to give them. From there, it can go different ways. They can submit, and this normally goes through the House initially. They submit either bills for each agency. They can submit bills for each appropriations committee, or they can submit one bill with the entire budget. Sometimes, and normally, those bills include the line items and the amounts within them. Sometimes it's simply a lump sum. That, for instance, just making up numbers, the Department of Human Services gets $45 billion for operational expenses, and it's up to the department to choose how to spend them from there. That is not the usual situation, but it has happened in the past. It's when the General Assembly really wants to take the pressure off of themselves and show just make the governor and the executive branch make the hard decisions. That normally doesn't happen. But so budgets need to pass both houses of the General Assembly by May 31st to use a simple majority. If you go past May 31st, you need a supermajority. So what happens is there's normally a lot of movement in the month of May and later, or just later in the month of May. And usually one of the last things the General Assembly does before they adjourn for the summer is pass the budget. And then it's up to the governor to sign it or not sign it. He has line item veto authority, so he could veto specific points. He could change things in the budget. But if he does that, the General Assembly can come back and either override or accept his vetoes. So people are concerned this year that there will not be consensus enough to pass a budget by May 31st, and the General Assembly will be going into the summer to try to find something. But from there, we would need both houses to come together and pass something.
Great, Dan. Thank you for that explanation. We have a question here about childcare services. Might you be able to talk a little bit about what this budget may mean for cuts to or services for childcare?
So I'm not an expert on this, but sure, I can give a go. The FY15 budget was not fully funded for the appropriation needed for the childcare budget. So currently, there's a great momentum and encouragement and pressure on the governor and the General Assembly to come up with some sort of solution for that, as well as other things in the budget that were not fully funded as appropriated. But people will be losing, like the state's funding will be going away for some of those services, and a lot of people who rely on them so they can go to work will not have a place to send their children if we do not come up with a solution. That is something the FY15 fix is currently being negotiated back and forth. Depending on the day, it depends on the day for how well that's going and who you ask. But they're working on it. But if they don't fix it soon, there will be some dire consequences before the end of the fiscal year.
Great, thanks, Dan. So with that, we are going to wrap up today. Again, the registration link for the in-person advocacy days, it's www.aidschicago.org/advocacy days. And that information, that link and information we will tweet out and it will be on our Facebook page, so that will be readily available to you. If you do have any questions that maybe pop up later in the day that you maybe didn't think of during this webinar, go ahead and tweet them to us at AIDS Chicago, and we will be sure to answer those questions.
And we look forward to seeing you in part 2, starting here in about 10 minutes, as we use our participants guide to contact the House and Senate leadership, appropriations committees, and the governor.
Thank you so much.
Thank you.
Thanks, Dan.
Thank you.